viewers, welcome back. This is yet another episode of Skills versus the Midwife Amidst Heroes. And today we are coming back here to this forum to discuss further. The last time we met, we actually discussed about one of the obstetric emergencies that is called prolapse. Now today we are going to look at, it's not really an obstetric emergency, but it's one of our major complications that we can see during pregnancy from a multiple gestation. So just remember, as we proceed on with this session, you can put your story on the comments, you can narrate what your experiences has been, and you can also tell us where you're coming from, which is your university, where have you been doing your practical session, and what it is that you've learned that can actually impact the generation to come. So we are happy to have you back. I hope you enjoyed this session, and today I have yet another guest. Maybe he can introduce himself.
Hi, my name is Stephen. I'm from Bungoma County. I'm currently a student at Kenya Methodist University, pursuing nursing, Bachelor of Science in Nursing. And during my clinical part, I was at Embu Level 5 Hospital, and it was very much interesting for me.
Okay, so let me ask you, Stephen, you were here for what period of time in Embu?
Embu, I was there for around 4 months.
4 months, but particularly the labor experience?
During the labor experience, I was around 4 weeks.
4 weeks, okay. And you were able to learn the various skills and competencies in that area. Yeah. So now we want to look at what Stephen was able to learn. Yes. We want to listen to him today and get to understand what it is that really touched him and what it is that he wants to pass on today to us all. Remember, here we want to nurture passionate nurses and midwives who can be able to impact the lives of people tomorrow. So we are not just taking care and providing service just from out of the blues. No, we are here to provide service that will impact and benefit someone for tomorrow. So Stephen, how was your experience like? And maybe you can tell us more about this condition you are managing. I understand you manage a multiple gestation and you are able to deliver. I really can't wait to hear this experience. So you can tell us, and please listen in so that we can be able to learn from wherever we are.
Okay. The condition I'm going to discuss, it was about the conjoined twins in a breech presentation. And that type of breech presentation was a foot-link presentation. So this mother came in with the contractions. By that time I was not on duty. Another student nurse was on duty. Then the nurse received now the mother in labor ward and did abdominal palpation as normal. Then the findings that now this student he did not now came up to diagnose well or to come up with the correct findings. He said, or he reported, that the mother had one fetus.
Sorry, Stephen.
Yes.
Was this first year student, third year, fourth year?
Oh, he was a first year student.
This was a first year student.
From can I mention the?
Well,
yeah, from Embu
yes.
KMTC.
Yes.
First year student from Embu KMTC. So, from my knowledge, the student had that enough skill now to come up with diagnose well this mother. So during that time, we reported that the findings, the mother had one fetus. The fetal heart rate were present, just one fetus, fetal heart rate one. Then also on vagina examination, the mother was 2 centimeters at that time. Then from there, he never called out the qualified to confirm. Okay. He just continued the process and admitted the mother there and NC ward. So during the NC ward, the mother stayed there around 24 hours. But I think the doctors or maybe the nurses who reviewed this patient or this mother never recognized that the mother had these conjoined twins and this maybe fetus are in breech presentation. So the following day, after 24 hours, at around 1 p.m., I was on duty now. So the mother came in, then I was the one who received the mother. Then at that time, before you proceed with the process now to monitor this mother, you need to confirm whatever you have received or the report had been given, if it is correct or not.
So it's part of the handing over procedure that you
exactly.
have to go through.
Yes. Okay. So I received the mother, then I confirmed that the report is saying. Then on my findings, I start doing the head-to-toe assessment. Then from there, majorly I focused on abdominal palpation or examination. Then now on abdominal palpation, I noticed that on fundal height it was around 38 centimeters. Then on palpation, I found that we have two masses. I can call them masses. One on this side, then another one on the other side. The two masses.
What was the consistency of the mass? Was it hard?
It was hard. This part of the upper side was very hard. Then now I was not unable to confirm it is it twin, is it which part is now presenting or which part is not presenting. So from there I confirmed if it is engaged or not, and at that time it was engaged. Then now on vaginal examination I realized that the mother was 7 centimeter dilatation. Then also now to enter inside, I had to confirm the part that was presenting because I was not sure which part is presenting.
Yes.
Now to enter into vagina to confirm which part is now presenting, I realized that the part that is presenting is somehow soft. Because the normal cephalic presentation, we need to feel a hard, which is now the head, yes. Which is when you now do a vaginal examination, you will feel it so much hard.
Yes.
But now for me, after now doing that vaginal examination, I realized that the part that is presenting is somehow soft.
Yes.
Then I now enter to confirm because on palpation or now abdominal palpation, I realized that we have a hard mass.
Two masses.
Yeah, two masses which are so much harder. They're not soft like now the buttocks which somehow they look
soft. Yes.
Yeah. Then now, that's why I was wanting now to know which one is presenting and what is it. So that to differentiate between now if it is now the head of the fetus that present or now the buttocks, you need to go in and confirm that now you can enter because it can be a facial presentation with the buttocks. So after now entering in, I saw I felt like
your hand went through an orifice?
We had an orifice.
Yes.
So in that orifice it was somehow soft, yes, and smooth. And now to confirm if it is the mouth of the fetus or maybe the anal of the fetus, you need now to see.
So what was in your glove when you came out?
So when I entered first in, if it is now for normal condition, if it's now the facial presentation, if you enter into the mouth of the fetus, you will feel the fetus is sucking those fingers.
And what if it's not sucking? Is there any other way you can actually tell it's not a breech, it's a facial, apart from the sucking?
If it's now the facial, you see the facial will have the bones at this point.
And in comparison to, I know, for example, you can say the anal orifice is tighter, compared to the mouth, right?
Yes, yeah.
And that's why if you get in and realize the orifice is tighter and probably compared to the mouth, which is a bit wide.
Yes.
So that's also something else that can tell us the difference, right? Apart from also things like meconium, you get out from the anal.
And so now, after now coming out, because I've not feel now that the fetus is sucking those fingers. So now coming out, I saw in my gloves, we had the fecal matter, the meconium now.
What color?
Fingers. It was brown in color. Brown, like greenish brownish. So from there, because it's like something I was not sure of it.
Yes.
Then I called now the in charge to come and confirm because the in charge was on duty. So the in charge came in to confirm my findings. Then I told him I'm feeling this and this. So he went up and did the same procedure to confirm.
Yes.
On abdominal palpation, yes, my result and his result were matching.
They were
perfect. Then now on vaginal examination, still they were matching.
Yes.
So he ended up saying that you are true. Whatever you did
assessed was correct.
So I ended now up to give now the findings to the mother.
Yes.
So on reporting to the mother, I told them that whatever you are carrying is this. You have twins. you are having a multiple pregnancy, you have 2 fetus, and all of them they are breathing well. The fetal heart rates are present all. The first one had 144 now beats per minute.
Yes.
Yeah. Then another one had 142 beats per minute. Then I told now I gave the report to the mother. Then the mother accepted the report. Then I reassured the mother that so many people have come in this facility with the same condition, but we have tried all our best now. They are delivered well. So don't worry, everything will be okay. So I was the one who was managing that mother, and I tried all my best way to manage the mother to be in a correct mood now, in a condition, and also accept the condition and deliver well. So we were not sure at that time if it is conjoined twin or just multiple pregnancy. In a separate way.
Yes.
So the time goes by, we went by. Then after some time, the mother had a poor progress, had a prolonged labor.
Okay.
Then we now planned, the doctor called in to review the mother.
Yes.
Then the doctor planned to put this mother on oxygen.
Yes.
Then also to infuse the normal saline to clear that meconium, because she had meconium. And also he planned to take this mother to theater.
Because of poor progress, of course, yes.
So I did the same, whatever the doctor had planned. I put the mother on oxygen, I infused the mother, and also I continued reassuring this mother to accept the condition and everything will be okay.
So at what point did you realize this was most likely to be a conjoined twin?
So,
was there any point that was actually
exactly.
realized?
So after that time, the mother continued the contractions, but not that much well. Then it reached a time where the mother now felt that like she's pushing.
She wanted to push. She had to push.
Then when she was now trying that way of pushing, we had one part that was presenting now.
Yes.
So it was not that part of the like the way I found before. So the part that was presenting was a leg.
A leg.
Yeah, a leg. And this leg now had after now coming out, this leg had 8 fingers.
8 fingers.
Yeah, it had 8 fingers.
How many of us have ever met?
So I was so much surprised. What is now inside? You see, 8 fingers and it's just one leg. So I was so much surprised. But now, because I was so much confidence with whatever I'm doing, that one made me now to continue reassuring the mother and also continue the process.
Okay.
Then later, after now seeing that the fingers, those now the leg with the 8 fingers, I called the in charge to come and confirm.
Yes.
So in charge, after confirming, he said that this one is a deformity, just a malformation.
It could be they thought actually it could be a deformity. Yeah, they could actually be right. Yeah.
But for me, because I was so much confident with that, I told him that this one.
So what convinced you that you didn't think it's a deformity?
Because on abdominal palpation, yes, I felt that two fetus now. I felt 2.
And 2 fetal heart rates, 2 heart masses. Everything was 2.
It was twins. Yes. Actually, it was twins. And also now at this time I'm seeing a one leg. So it can
with
be
8 fingers.
Yeah, it can be a malformation, and it's
not 8 fingers, 8 toes. It's the leg.
Exactly. So that one made me to have that confidence that this one's
it had to be a multiple pregnancy conjoined.
It can be a malformation.
Yes.
It's a conjoined twin.
So did you go for CS?
I know. So after that time, the leg is now out. That leg is now out with the 8 toes.
Yes.
So I don't know what told me not to do that one, but something just like a spirit, I don't know. But just told me not to enter vaginally
to do another vaginal exam.
To confirm what is now inside.
Yes.
So when I entered in the vagina, I felt also another leg.
Okay.
Yeah. Right. Then I did I deflect that leg and try to pull it out.
Yes.
Then actually it came out.
And at this point, what is the condition of the fetuses? At this point,
the condition of the
fetuses, was there still the fetal heart rate, or they were still present?
They were present at that time. Then after now removing another leg, so there are 2 legs now outside.
Yes.
Then something also still told me go in and confirm what is inside again. So when I entered in, I also noticed we have another leg.
Yes.
So same, I deflect the leg and pull it out.
And try to activate. Okay.
So we have 3 legs now outside.
Yes.
Yeah. So the nurses,
was the nurse still there with them?
They were there, but now they are shocked and surprised. What is not happening? You see. So after that, the in charge was now around was there. Then I told him that what can we do now? Because this mother
is like theater, she's almost pushing.
And also she's pushing.
Yes.
What can we do? Then now in charge told me now to now increase contraction by augmenting and also giving the mother oxytocin.
Yes.
So I did the same and also encourage the mother that if now the contractions comes later, now push. I will assist her. And in a bridge presentation, the normal bridge presentation, we don't pull or we just allow the mother to push.
Hands off. Hands off.
Yeah, just allow the mother to push. Now, but at this condition was so much surprising to me. Yes. And also the mother had that strong contractions. She had not that strong contractions.
And actually, Stephen, maybe we need to have an outlook of what it actually was. Because we had some photos. Maybe you can pull it so that our viewers can see.
Okay.
And it's a very interesting type of conjoined twins where we have they are conjoined, the feet, okay? The feet is conjoined, and we also have the part of the pelvic region, all right? The pelvic region is also conjoined. I don't know if our viewers can see this. So if you look at this closely, they are conjoined in a way that we have the anus, the area of the pelvic region, and both, it's like one of each of the legs is also shared, so they are also conjoined. And as you can see, probably you can see what I'm trying to show you. This is what student nurse Stephen was able to deliver in that labor ward on that day. And I tell you, this was a report that reached our ears, and we were very happy because, proudly speaking, this is a student who really did not give up. I think there are people who would have probably ran away or thought it was some kind of. Actually, did that happen?
Yes.
Did anything like that
so
happen?
After now, those legs are out now. I now assisted the man to push.
Yes.
But now for me, I pulled now.
Yes.
Yeah, I pulled the fetus.
Yes, you deliver the fetus.
So I pulled, and the mother is also pushing.
Yes.
So at that time, everything now came out.
Yes.
But now before, now at the time of delivery, 20 minutes before the time of delivery, the fetal heart rate now they ceased.
There was no fetal
there were no fetal heart rates. So the plan of now going to theater stopped now. Yeah.
Ceased.
So the in charge just say that let us continue now, assist the mother to deliver this fetus. Yeah. So I pulled, and everything now came out.
Yes. What was the reaction? I really want to know the reaction of people in this ward. Were there students? Were there medical people? Were there doctors?
Yes.
Were they surprised to see this?
Actually, there was so much surprised because it was something that it's very new.
It's
actually in the whole hospital.
Yes, or you can say it is something that is very rare. They have never seen something. Yes, we talk about conjoined twins, but probably this was a rare one because personally, even in my how many years of practice, 10 years, I've not met this one before. So and that's why we are saying kudos to you, Stephen. I am imagining if you were not confident enough to recognize this was a multiple pregnancy, you know, the fact that you were able to diagnose, and that is why we are here to encourage you. We are here to encourage that one student who feels like that knowledge is not making sense. It will make sense because you have learned and you're going to deliver that transition will work. And I like the fact that the nurses were also very confident and they were there to support you and to make sure that this process was completed. I'm imagining if you were in a setup where you didn't have support, and that is why we're talking about support systems. Yes. So we need to nurture these skills as much as possible. So what do you have to? Yes.
After delivery, after now. The fetus, those now the bodies, I can call them the bodies now that are out.
They are out, yes.
And now I called one of the student nurse to come and receive.
To receive that the conjoined twins.
To weigh now the weight.
I'm imagining what their reaction was.
Because we need to know how to write a report.
Yes.
So after now calling one of the student nurse who was around to come and receive now.
Yes.
Actually they received. They refused.
They refused?
No one accepted. Because I was so much surprised.
Yes.
They refused. So I was forced now to want.
You yourself to take the babies aside and to work them, weigh, and
actually they weighed 3.8.
Both of them.
3.8.
The total weight for both of them.
Weight, yeah.
Okay.
3.82 kg.
Yes.
Yeah.
Wow.
And from there, after delivery,
yes.
The mother wanted to see now the babies. Yeah. So.
Did you do some debriefing for the mother? Some
counseling? Actually we did, because it was not that easy for the mother.
This was the second pregnancy or just the first one?
It was the second pregnancy. The first pregnancy delivered very well. And also had no history of the conjoined twin or maybe malformation during the previous
pregnancy. Wow!
At this time, now after delivery, the mother wanted to see the babies.
Yes.
So I asked the mother, will you be able now to see? Will you be that confident to see this big feet and the babies? The mother said, yes.
Yes, I want to see them.
I want to see them.
And it's their right, you know?
Yeah.
Yes.
So I told the mother to lift up and see them. And they see the babies.
Yes.
So the mother saw the babies, but now she was so much shocked and collapsed. You see, she collapsed at the end. Yeah. So we had that another work now.
It looks like another emergency again.
Another emergency again. Now to assist the mother.
That was
at the same time doing this one. So it was so much interesting for me.
Yes.
Actually it was so much interesting.
Wow.
Even the doctors who now had planned now to take this
plan for the cesarean section
for CS. The time arrived and they called the mother to go to theatre. But now we told the mother has already delivered. But whatever she has delivered
is now what is
now.
You couldn't explain.
It's now surprising us.
Explain, yes.
So the doctor also wanted to see.
Oh, so they came and they were interested.
All doctors from even the outpatient.
What do you mean?
From the ward.
Outpatient?
Yeah. Even from the ward came now to see what is it. Yeah.
Wow. A hero in making.
Even they were so amazed.
They were amazed, yes.
And
we are very, very proud of you. I'm actually tongue-tied. I don't know what to say, but you are one confident student, and I think there's so many people who are going to learn from you today.
Exactly.
And they're actually going to realize that yes, being a student doesn't mean you cannot do some of these things, especially when it comes to diagnosis. Most of us actually get a little bit, they lack confidence in when it comes to that. You always want to, okay, come and confirm, I'm not sure, how did this go, after your V, how did I do that V? So you realize that the confidence levels can be affected in one way or the other. But we are very happy. What do you have to tell those students out there, those ones watching us from wherever they are?
So first of all, whatever I want to tell you, my fellow students, being confident and also being aggressive and curious to want to know things will help you much. Because my confidence, because we are acting with the in charge, imagine we are acting with the in charge. The in charge was saying this one was malformation. For me, I was saying this one is a conjoined twin, and I was so much confident with that. So confidence is something that will help you during a clinical rotation to achieve you are now the goals or maybe the objective during the clinical rotation. And also being aggressive now to know what is now going on and what is happening during that clinical.
Be aware.
Be aware.
Be aware of what is happening in the environment.
Exactly. And also have that confidence to know more about something. Learn from other students from KMTC, they are there. The interns are there, the qualified nurses are also there. So learning is also very important. Actually very important.
And today, we want to tell you that you can do it.
Exactly.
It doesn't matter. No one is born perfect, and that is why this program is meant to uplift someone out there. And with your confidence, you can achieve much. Just remember, we are here to nurture with passion the nurses that will take care of us tomorrow. And if we don't do that, then who are we leaving behind? The legacy lives on.
Yeah.
See you in the next video.
Bye.